Hi, I'm Melissa. I'm a student nurse practitioner, and I'm going to be doing a head and skin assessment for a video for class. Okay, and this is my patient, Curtis. All right, so I'm going to first start while I'm talking to him and introducing myself. I'm going to be assessing his body structure and posture, general appearance, his skin pigmentation, all of that. And when I shake his hand, I can be assessing for skin warmth and moisture. And as I do a whole head to toe assessment, I will be assessing the skin. We can start by doing the turgor test. And his turgor is just great nutritional status. I will also look at his nails, which are smooth and no abnormalities. Do you have any skin lesions that you need addressed?
No.
Okay. And then I will move on to your head and scalp assessments. I'm going to first palpate your head here for symmetry and shape, and check hair distribution and for any oiliness. I will continue to palpate your jaw here. Can you open and close your mouth? And this is checking cranial nerve 5. And then I'm going to palpate your sinuses. Any tenderness there?
No.
Great. And then I'm going to check cranial nerve 7. Can you raise your eyebrows? And can you puff out your cheeks? And can you show me your teeth? And can you frown? Very good. The cranial nerves 5 and 7 motor are intact. I'm going to have you close your eyes. And we're going to...
Yeah.
Okay. Now I'm going to check sensory of cranial nerve 5. So if you'll close your eyes, I'm going to touch left, right, or both. You tell me which side I'm touching.
Left.
Very good. And I would test that bilaterally. All right, now we're going to move on to our eye exam. I'm going to first get my otoscope here on the right, and we are going to check first that you can open and close your eyes, which is checking cranial nerve 3 and 7. So go ahead and close your eyes. Now open them, and those are intact. As I'm looking at your eyes, I'm also looking at positioning, and I'm also looking at eyelashes and eyebrows for any infestations or abnormalities or hair issues. All right, so go ahead and look at my nose or at some point in the distance, and I'm just going to look at your sclera, your cornea, and your iris, and I will do that bilaterally. I'm looking for the shape, color, and clarity of those. Now I'm going to test for direct and consensual reactions. So I'm going to have you continue looking at that spot in the distance, and I'm going to see if your eyes constrict. And the left eye constricts. Now I'm going to look at the right eye for consensual constriction. Very good. And this is checking cranial nerves 2 and 3 for direct and cranial nerve 3 for consensual. See, now I'm going to have you look at me and follow my finger. This is checking accommodation, and I'm looking to see that your pupils are constricting as you follow my finger in, and they did. So now we're going to check the extraocular movements. This is checking cranial nerve 3, 4, and 6. So go ahead and follow my finger. Very good. And those are intact. Now I'm going to check your well, I'm going to do a fundoscopy. So I'm going to change to ophthalmoscope here. And there we go. All right. So I'm going to have you look at an object again out in space over there. And I'm just going to hold your head here. I'm finding the red reflex. And I'm going to find the optic disc. And I'm going to look at the arterial arteries and veins. They all look good. Very good. I'm looking at the optic disc for size, shape, margins, all of that, and it looked great. And I would do this bilaterally. And I checked the macula and fovea centralis by moving nasally when I was looking. Those all look good. Also, I'm going to check your palpebral and transdiva and lacrimal glands, and those are pink and no discharge or swelling or anything like that. Okay, now we're going to do our ear exam. I'm going to first palpate the pinna and the tragus and the mastoid. They all feel good. I'm going to start by doing a tug test. So I'm going to grab the pinna and pull back. Any pain with that?
No.
And that's to test to see if we have an infection internally. Now I'm going to take my otoscope, turn on the light here, and I'm going to pull the pinna up and back. And as I'm going down to the tympanic membrane, I'm going to look for any cerumen, foreign objects, or lesions. And he does have a little bit cerumen, but not much. And then I found the tympanic membrane, and I identify the umbo, the annulus, the pars senta, pars flaccida, and the menibrum. And everything looks great there. Okay. And then now we'll move on to the nose. So I'll first look at symmetry and the septum, make sure that it's not deviated or anything. If you'll lift up your nose here, making sure I go from ear to nose, I will take my otoscope and have you tilt your head back here and take a look in your nair. And I'm just looking for, let me tickle you. Just looking for color, any drainage or anything, the turbinates, all of that, and it looks good. Nice pink color. Let's see. And I'm going to occlude one nostril. Can you breathe in? Very good. Any issues with that? And I'll check those bilaterally. Okay, good. Now we'll do the mouth and throat. So I'll take off that guy. So I'll look first at your lips, see if there's any lesions around the lips, any cracked lips or anything like that. Go ahead and open your mouth for me. Wider. There you go. I'm going to first take a look at your teeth and your gums. All of that. And looks good. Can you, there you go. And can you say ah? And I'm checking cranial nerves 9 and 10 with that to make sure that the uvula rises with pronation, and it did. You have a tonsillectomy, so you don't have any tonsils, but the soft palate and hard palate are good, intact, no lesions or anything, nice pink color. Now if you'll, and I would put gloves on, but for the purpose of this video, can you open your mouth here? And I'm just going to palpate the inside of your cheek here. And can you put your tongue to your roof of your mouth and check underneath the tongue for any lesions, check the ducts, and feels good. Can you stick out your tongue and push against my finger here? This is checking cranial nerve 12, and we would do that bilaterally. And this would be the conclusion of our head and skin assessment. Okay.